So we're going to go ahead and get started, and what I like to do is first introduce myself. Of course, most of you guys know me. I'm Sherry Bowen. I'm the heart failure case manager here at Kaiser, and most of you at one point have spoken to me on your discharge from the hospital, or as I may have gotten a referral from your primary care or cardiologist to speak with you about heart failure. But of course, you know, with heart failure, it doesn't mean that your heart is actually failing. It means that your heart is actually not pumping effectively like it's supposed to. And so in order to get heart failure under control, for you to live a better and a healthy life, what we have to do is we have to make some lifestyle changes. We have to get rid of those old lifestyle changes and bring in something new. And a lot of them are not new changes, it's just things that we've, over the years as we've gotten older, we're just not doing them any longer. Of course, we want you to limit your salt. Salt and your water is very, very important, because salt and water, they stick together, they're lovers. So if you get too much salt, too much water, you're going to end up with the swelling, the shortness of breath, back in the hospital, weight gain, chest pain, all those symptoms that we tell you that you need to look for on a daily basis as early warning signs for heart failure. Again, the number one thing is that weight gain, and that is why we do tell you to make sure that you are checking your weight every day. Again, talking about limiting your food. You want to limit processed foods, canned foods, eating out at restaurants. When we talk about processed, anything that's man-made that's not natural is going to be processed. Bread, some breads are full of salt, barbecue sauces, seasoned salt, things of that nature that people really enjoy to season their foods with. We want you to get rid of it and try to do things that are more wholesome and all natural. Your meats, you want the leaner cuts and portions of your meats. You want to trim away the fat. You want to do more baked and broiled. Try to do no fried. Eating out at restaurants, you have to be very selective, because they use salt in restaurant foods to preserve it so that you can keep it, they can keep it fresher, so that you'll be able to eat it. Again, weighing yourself every day, as I've already stated, is very important. And it is extremely important that you and your family understand what heart failure is, what you should do if you have symptoms and your conditions begins to change, and how your doctor is treating you. And so with the treatment portion of it, that goes into medications, following those recommendations of those diet and lifestyle changes. Make sure that when the doctor prescribes your medication, that you know what medications you're on, why you're taking the medication, that you're on the right dose. A lot of times when you guys come in the hospital, some of you don't get rid of old medications or old prescription bottles, and you may keep one in the back of the shelf. Always either get rid of or discuss thoroughly with your doctor if those medications you have at home can be taken in or cut in half, or if you could take more, so that you can get rid of those things that you don't need. It's very important for you to make sure you keep your appointments and follow up with your doctor. And again, any of those significant changes that we tell you to look for on a daily basis, you want to call. If you gain that 2 to 3 pounds in 24 hours, you're going to call. You don't have to call the doctor. You can call me. I can get in touch with the doctor a lot faster than you, or I can call the pharmacist, who can also assist with helping you getting your medications adjusted so that we can try to keep you healthy and out of the hospital. Now, how many people have seen the heart failure stoplight? Well, this is the heart failure stoplight. I know you have it, don't you? Mm-hmm. Okay. This is our daily guide to heart failure care, and the section in yellow is the section that we ask that you focus on and get that down to memory. Weight gain of 2 to 3 pounds in 24 hours or 5 pounds in a week. Swelling of your ankles, legs, or feet. It may also go into your abdomen area. Your stomach may feel a little bit heavy, and you may feel bloated. Increased shortness of breath, dizziness, lightheadedness, a dry, hacky cough. You may even have pink, frothy sputum. You may need more pillows to sleep on, because you got all that fluid that has started to collect in your body. It just has nowhere to go, so you need to sit up to sleep. And of course, if any changes or any problems with taking your medications, if you are taking your medications, for instance, if you get up in the morning, you take your Lasix at 6. Say by 7:30 you still haven't gone to the bathroom, you might want to start saying, is something going on? Have I gained any weight? you may want to consider calling, because it could be that your medications need to be adjusted. And of course, on the heart failure stoplight at the bottom, I have all the numbers listed here for all the cardiac clinics. My number's listed there, and of course a number to get in touch with your primary care physician. So if you don't have my card, or if you say you can't get in touch with me, this is another reference point to call me if you need anything. Of course, the nutrition we've kind of covered, but it's very important. If your doctor gives you a fluid restriction, you need to try to follow that to the best of your ability, and that means counting everything. For instance, if you have pudding, if you have a Jell-O pop, that's a liquid. Anything that was a liquid before it became a solid, you're going to count that into your daily intake of fluids on a daily basis. And most patients are on a 64 ounces of fluid restriction, but if your physician adjusts that and gives you something differently, you need to follow that. Please don't eat ice chips. Ice chips get a lot of people in trouble. For dry mouth, we encourage you to use sugarless candy or gum, because eating the ice chips will get you in trouble too, because once you're eating it, it's hard to stop eating it, and then you can't actually calculate it because it's frozen. So if you eat a whole cup of it, and say it's one of those cups, or that picture you get from the hospital, it's going to be more than 64 ounces by the time you drink everything in a day's time. And you want to limit your salt intake to less than 23 or 2,000 grams a day. 2,300 milligrams is what's equivalent to what you would find in a teaspoon of salt. So basically, no salt. That would be best for you. And we encourage you to use things like Mrs. Dash, onions, bell peppers, thyme, any kind of herb that you could put in your food that doesn't have salt. If it feels good, it tastes good, and your doctor says you can eat it, you're not on any other medications that will cause you to interact, we encourage that, because the salt is going to get you into trouble if you continue to eat it. Physical activity. It's recommended that you have at least 30 minutes of continuous physical activity 5 days a week for at least 30 minutes. If you just walk, just to walk from your front door to your driveway, maybe 30 minutes a day, that's going to increase your blood flow to your heart. It's going to increase the flexibility of your muscles. It's going to strengthen your heart, and you're going to feel better. And then it's going to help reduce the risk of osteoporosis, or softening or weakening of the bones as well as you get older, and stiffness. If you smoke, stop smoking. Keep track of your daily fluids. You want to weigh yourself every day at the same time when you get up in the morning with no clothes on. Avoid alcohol use or caffeine. Eat a healthy heart diet. Become physically active. Take your medications as prescribed. Keep all your appointments, and contact your physician if your condition changes. Again, for heart failure, as you all know, there is no cure for heart failure. However, what we do is, by putting you, your doctor does, is by putting you on the right medications, and with you buying into the plan that the doctor has come up with, we can keep you healthy and out of the hospital. Continue to follow your diet. Again, take your medications, like we say, to avoid admissions to the hospital. But again, your medications and your diet going to be so important to staying healthy and out of the hospital. And Dr. Kobe Lifker talked about some of the advanced treatments last week, so if we can get you just to stay on the path and working with us, we can keep you pretty healthy. So when I call and I'm asking questions, be honest, because I'm going to be honest with you.
So for those of you that don't know me, my name is Carla. I'm the pharmacist. I work with Dr. Kobe Lifker and Dr. Pulicottle over here. I think I've met most of you in the room. Today I'm going to be talking about medications, medications that you may be on in the future, and also some tips for managing your medications. I'd like to address any questions you guys have. So if you have a question as I'm going through, please feel free to put your hand up, or I'll take questions at the end. Or if at the very end you have something that's very specific to you personally, you can always come up to me and we can talk about something personally with your medications. So today, like I said, we're going to kind of discuss all the different medications that are commonly used in heart failure. Now, keeping in mind, as Dr. K mentioned last week, there are different types of heart failure and other heart failure conditions. So everyone's regimen will be specific to them. But there are some common medications that we use in many of our patients. I'm going to answer some common questions that I get asked a lot about medications, why they're taking things, when they should take them, what they're for. And we're going to talk about a few key tips that I have that seem to help people when they're managing their medications at home, especially for patients that feel like they're taking a lot of medications. So the most common question I get is, why do I need to take medications? With the diagnosis of heart failure, as was discussed previously, your heart pumping function is decreased. So basically, we use certain medications that may help with your symptoms. So some of the medications like fluid pills will help keep the fluid off so that you're feeling better. Some medications that we prescribe are actually heart protective. So we've done a lot of research in heart failure to look at things that help patients do better. And we found certain key medications for some types of heart failure do this. The research has shown that on good doses of some of these medications, patients tend to feel better. They stay out of the hospital longer. Some of them will even live longer. And some of these medications actually go in and help interrupt some of the stress hormones and chemicals in your body that can promote further damage to your heart. So a lot of these medications that we will use in heart failure are actually protective of the heart and help to fight off any future damage that can happen to your heart, as well as helping it to work as best as possible and to help you guys feel better for as long as possible. Of course, a key with all these medications is taking them as prescribed. If you have any questions about why you're specifically on a medication or why it needs to be taken a certain way, ask us. We have so many patients that may be scared of a medication or have a side effect from a medication and they just stop the medication altogether, and we find out 6 months later. So if something is going on, we genuinely want to know. So if you have any concerns about anything, you can pick up the phone, you can call Sherry, you can call me, you can call the advice line. But on our team here, we legitimately want to know what's going on, and we want to know before your next appointment. So don't be afraid to ask. So some common medications that we're going to go through today. Again, everyone's regimen is going to be specific to them personally, but common medications used in heart failure, we're going to talk about ACE inhibitors and angiotensin receptor blockers. We're going to talk about beta blockers, diuretics or water pills, aldosterone antagonists, and then another type of medications called hydralazine and nitrates. So we're going to go ahead and start out with a very common medication in heart failure, and these are called ACE inhibitors. These are the ILs. Here, the most common one we use is lisinopril. And this is one of those medications I was talking about that is very protective of the heart. It's also protective of the kidneys. Another thing it does is it does dilate your blood vessels. What this does is it allows easier flow of your blood to all of your vessels, to all of your organs that need that blood. And it's, like I said, one of those medications that can help you feel better, hopefully keep you out of the hospital, living longer. There are some side effects that you want to watch for. It can lower blood pressure. So a lot of times we'll follow up with you to see how your blood pressure is doing on these medications. We do like to keep an eye on the kidneys and potassium to make sure that they're doing okay on this medication. One of the most problematic side effects that patients will get is sometimes they can get a dry cough on this medication. If that's the case, usually we'll switch you to the next medication we're going to talk about, which is an angiotensin receptor blocker. The most concerning side effect, though, with this medications is some patients can get some swelling of the face, the tongue, the cheeks, the mouth, the throat. If this were to happen, this is a medical emergency. Go ahead and go to the ER. It's very rare, but it's something that I do like to mention to the patient so that if it were to unfortunately happen, you would know what's happening. So our next class of medications, the angiotensin receptor blockers. This is the medicine that we switch you to if you have a cough or a bad effect on the ACE inhibitors. These are all our TANs. The one that we use here most commonly is losartan, and for some patients we have them on valsartan here as well. These medications are very, 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 very similar to the ACE inhibitors. They have the same functions. They're protective of the heart, they're protective of the kidneys, they help dilate those blood vessels to get the blood flowing to the organs, and the side effects, again, are very similar with the exception that these do not cause cough. So again, it kind of goes back to communication. If your physician prescribes you an ACE inhibitor, lisinopril, and you have a cough, let us know because we have an alternative. We can switch you to something else that is a very good medication that will get rid of that nasty cough. So the next medication we're going to talk about are beta blockers. Carvedilol, metoprolol, and bisoprolol are the ones that are used for heart failure, and we do use all three of those here. These are, going back, another medication that is protective of the heart. Instead of dilating and opening up your blood vessels, though, it actually helps to slow your heart rate down. This allows your heart to fill with blood better when it's beating at a slower rate. So it's going to be more efficient. It's going to fill up with more blood, so it's able to pump out more blood. It also is one of those medications that can help you feel better, help you, hopefully stay out of the hospital, interrupts those stress hormones that can cause damage to the heart. Now, since it does slow down the heart rate, we want to keep an eye on your heart rate. We want your heart rate to be in a certain range, but if it drops too low, patients can sometimes feel things like dizziness, lightheadedness. If you're experiencing any of those things, let us know because we may need to check your heart rate to make sure that it's still in the good range and hasn't gone too low. Other than that, very few side effects generally with this medication. If you do have diabetes, you need to be aware that these medicines can sometimes hide those hypoglycemic effects, with the exception of sweating. So just something to be cognizant. If you're diabetic, you're on insulin, you need to be even more diligent in checking your sugars because this can sometimes hide those low sugar effects. For some patients, it can cause a little bit of weakness, fatigue. A lot of times that'll be transient. Usually when we first start it, you may have a little bit more fatigue, but that will improve after a couple weeks of being on the medication. And some men will have some sexual side effects with these medications. Again, if you experience any of these things, let us know. We can always work with you and try to get you on something that works for you. Okay, so aldosterone antagonist. This is the last medication that I'm going to talk about that falls under that umbrella of protecting the heart. This medication here, we commonly use spironolactone, although there is an alternative medication for it. It's called a Eplerenone that we will sometimes use for patients. This medication does a lot for you. Like I said, it helps prevent the heart, reduce all those stress hormones. In addition, it also serves as a mild fluid pill. So it'll help get rid of some of the fluid. It also helps your body hold on to potassium, which our body can lose from other water pills. So this acts as a very mild water pill, but also helps your body hold on to potassium. There's some benefit of this medication for patients with sleep apnea. So you get a lot of bang for your buck with this medication. Generally, it's very, very well tolerated. For most people, it doesn't affect their blood pressure, their heart rate, any of those things. We will do some routine lab monitoring because we want to keep an eye on the potassium that we're helping your body hold on to and the kidneys. The most common side effect that is generally seen here, it's not common, but it can be troublesome to people, is a little bit of breast tenderness. And again, if you are on this medication, you experience this, let us know. There are alternatives. We can always try you on a Eplerenone, which has a lower incidence of having any of that side effect. This, like I said, is one of those last medications that is very protective of the heart. We don't have all of our patients on this medication, though. This one is very specific for certain patients that we've seen benefit with. So, diuretics or water pills. These medications, I saw that. These medications do not fall under the classification of medications that are protective of the heart. Now we're talking about helping you feel good and keeping the fluid off. With heart failure, most of our patients have problems with retaining extra fluid because of the heart failure. Think of it as Atlanta traffic with short stoplights. Your heart is pumping less blood with each beat. So that's kind of the equivalent of a backed up stoplight with a short light cycle. Fewer cars are getting through with each light cycle, so you have the buildup. Well, the fluid's sitting in your lungs and your ankles. Your lungs are like, hey, I'll absorb you. You can hang out here for a while. Same thing with the ankles. And that's where you get a lot of shortness of breath, a lot of swelling, and it's difficult for that fluid to get back into circulation. And that's where these come in play. Furosemide and torsemide are the two that we use most commonly here, and they do a very good job of sucking that water back up into your veins and excreting out through your urine. So it's not without side effects. You know, these can lower your blood pressure because we're losing a lot of fluid out. We have to watch your electrolytes very carefully because where water goes, sodium and potassium are going to follow. So a lot of times we'll have patients on potassium replacement if we have to use these as well. We like to watch the kidneys because these medications can be stressful on the kidneys, which is why we talk so much about everything Sherry talked about, weighing yourself at home, letting us know early on if you're gaining weight, because then it's a lot more gentle to get 3-5 pounds of fluid out. If we have 20, 30, 40, 50 pounds, that's a lot more stressful on the kidneys. So that's why we stress so much letting us know early on. And metolazone is another diuretic. Sometimes we will use in combination with the other medications if we need that extra bang for our buck. So some other medications I just want to touch on briefly, because a lot of these are very common medications to see in heart failure, but they're very specific to the patient, depending on what other heart conditions they have, how their blood pressure is running, and what their symptoms are. So some medications that we will use pretty commonly is a blood pressure medication called hydralazine, and something called nitrates, which could be nitroglycerin, or most commonly isosorbide, either mononitrate or dinitrate. Commonly we'll use those in patients that can't take some of the other medications that we would normally use as a replacement, or in patients that maybe still have some higher blood pressures on those medications. These are beneficial. Digoxin is another medication that some patients may be on. Blood thinners, depending on what other heart conditions you have, you may be on aspirin or Plavix or warfarin. Antiarrhythmics, if you're having an irregular heart rate, sometimes we'll put patients on these medications to keep their heart in rhythm, to help their heart be able to pump better and perfuse. Amiodarone is the most common one we use here. And then cholesterol medications. Simvastatin, atorvastatin are the most common ones we use here, but we also have lovastatin, pravastatin, and rosuvastatin or Crestor. Typically, we use these in patients that have other heart disease, if they've had a history of coronary artery disease or strokes or diabetes. And while these medications aren't treating heart failure specifically, they're very important, because what they're doing is they're helping to protect your heart from having either a first heart attack or maybe a second heart attack if you've already had one. And if you look at the grand scheme of things, we already have the heart failure. The heart is not functioning at 100%. The last thing we need is more damage that can be done to the heart that can create even bigger of a problem. So even though some of these medications, like your cholesterol medications or your blood thinners, are not specifically treating the heart, they're keeping the heart healthy, which is the key to keeping your heart failure stable, as opposed to getting worse. So this is another topic. I usually get mixed responses on this, but vaccines. There are, I see heads shaking in the background. So I'm going to talk about why we recommend certain vaccines for heart failure patients. The specific ones that we recommend is an annual flu shot, usually between the months of October and November. We like to vaccinate before flu becomes prevalent, because the flu vaccine does take a few weeks to reach full effect. And then pneumonia vaccine or pneumovax. The reason we recommend vaccines is because we've looked at patients with heart failure and found that because of the heart condition, one, you're more prone to getting these diseases from other people. So if you're in a room with, some people that have the flu and you're standing next to me, you may be more likely to get the flu than me. Although me personally, I get the flu all the time, but you may be more prone to getting the flu than me. The second thing is if I get the flu versus somebody with heart failure, I'm a very healthy young individual. Chances are I may be out of work for a day or two, but I'm going to bounce back and be completely 100% to where I was within a week. Somebody with chronic conditions like heart failure, we run the risk of having complications, a lot of complications that could wind up in hospitalizations, other medical conditions that start becoming problematic, or even death. We do have people in this country that die from these diseases every year. And to touch on something personal, my best friend's father died from flu complications last year. He had a heart valve replacement. He was anti-vaccines, didn't want anybody poking him with a needle. It all started as the flu, and everything progressed from there. And then he wound up in the hospital, and unfortunately he passed. So I can't say that the flu vaccine would have kept him alive, but it might have. Because if he had never gotten the flu, he may never have had those complications from the flu. So I know vaccines as a whole are a very hot topic of controversy, but there is reason why we recommend these, and they're to keep you healthy. Because unfortunately, having this condition makes you more prone to getting these diseases and really suffering from them as well. And again, if you're coming in, we're looking at your chart saying, oh, hey, it's time for your annual flu vaccine, or oh, hey, you haven't had your pneumovax, let's give it to you. If you have any questions, if you have any concerns about it, ask. It's your right to decide whether you want the vaccine or not. Obviously, I really promote you getting the vaccine. But if you have questions, if you have concerns, if you are afraid of it, let us know. Because maybe we can talk to you about it and see what your concerns are and determine what to do from there. So it all goes back to communication. So medications that you shouldn't take. Slightly different turn. Over-the-counter pain medications. Tylenol is generally safe. You may want to talk to your doctor if you have a history of any sort of liver problems. But aside from that, Tylenol, as long as you're taking the amount recommended on the bottle and not exceeding it, is safe to take. All of the other over-the-counter pain medications we want you to avoid. All of the ibuprofen, Aleve, naproxen, Motrin, we don't want you taking. For several reasons. They can be damaging to the heart, damaging to the kidneys, and they can actually make you hold on to more fluid too. Oral decongestants. Pardon?
Excuse me, go ahead.
Okay.
Speaking out loud.
Oral decongestants, especially Sudafed or pseudoephedrine, can actually be stressful on the heart. It can raise heart rate, raise blood pressure. There are cold medications. If you have a cold, there are medications that are safe to take. Talk to the pharmacist. Let them know that you have a heart condition and ask which ones are safe to take. As a general rule, I don't know if anybody's noticed, but certain cold and flu medications, now you have to ask at the counter. Those are no-nos for you. If they're out in the general population where you can just pick it up off the shelf, they're probably going to be safer, but I would still bring it up to somebody and ask, I have a heart condition, can I take this one? There is a brand named Coricidin. It actually has a heart on the box. Those are okay. Anything else you want to check. Antacids. Thing that says sodium bicarbonate, the sodium is the salt. So a lot of your Mylanta, Maalox, Alka-Seltzer, especially those liquids, have the salt. If you're having stomach upset, if you're having heartburn, let us know, because there are alternatives that we can recommend for you to take that can potentially be more effective and they're going to be safer. But if you start chugging these, you may start to notice that your ankles swell, and that's because they're salt. And as a general rule, with any sort of an herbal product, supplement, even over-the-counter medications that you want to take regularly. Again, communicate with your providers, talk to us, let us know, ask. A lot of those medications that are out there, even over-the-counter, they're deemed safe for the general public. That general public definition doesn't include patients with heart failure. So always ask, we don't mind. And you know, if you just want to pick something up over the counter, don't be afraid to ask the pharmacist that's behind the counter. That's what they're there for. So a question I get a lot is, why am I taking so many heart pills? You have a list of 7 different medications, and they all say for the heart. And a lot of times they're all the medications that we just talked about earlier. And I hope you can see each medication works in a very slightly different way. It's one of those things where 1 + 1 doesn't equal 2, it equals 10. So they all work in slightly different ways that add up to create a really good solid effect. So they're all for your heart, but they're all working in your body differently. So the additive effect is great. The sum is greater, the whole of the parts is greater than the sum. There's a cliche and I'm missing it. Or in the business world, I think they use the word synergy, where you have all these parts working together. Another analogy I'll use is it's kind of like an alarm. An alarm system on your home serves one purpose, to protect your home. But you don't just put one sensor on the door. You put them on the windows, you put them on the back door, you put them on the garage door, because they're all protecting different parts of the home for the greater picture of protecting the home as a whole. So it's a very similar concept. They all work in slightly different ways in your body to have one overall protective effect of your heart. I get this one a lot too. You may go to see one physician, like say your primary care provider, and the nurse will say, oh, you know, your blood pressure looks good today. And they see you, they send you home, and then you come here and we talk about adding medications and increasing medications, and you're like, whoa, 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 whoa. Dr. Jones just said my blood pressure was good. What are we talking about? It goes back to what we were talking about before. All that research where we looked at with those medications that are protective of the heart, we have found that if we can get patients on higher dose, we get better benefit. So we always monitor very closely, because we don't ever want to drop your blood pressure, your heart rate, anything like that to a level that's too low or that would make you feel bad. But we may be a little bit more aggressive than non-cardiac physicians. Even if the blood pressure may technically be under the limit of where, you know, it has to be, we may want to drop it even a little bit lower so that we can get more of that protective benefit. So some helpful medication tips. You are in charge of your own health. So it is a good idea to be very aware of everything you're putting in your body. As I've said many, many times, if you don't know why you're taking something, ask. Make sure you know what you're taking, how often you're taking it, why you're taking it. I'm a big advocate of pill boxes. I can't keep track of a daily vitamin. So to me, anything more than 1 pill means I need an organization system. Staying on top of your refills. You are the manager of your own medications. So if you know that one time when you pick up at the pharmacy and it says 0 refills left, that's the time to start contacting your provider to try to get more refills, not when you have 2 pills left in the bottle. It's going to be more stressful for you. It's more stressful for us. And probably the biggest recommendation I have is keeping a medication list and keeping it on you. It can just be a small little index card that you keep up to date, put it in your pocket, put it in your wallet, put it in your purse. But what that does is if you keep updating it, anytime you go anywhere, whether it's the doctor's office, the pharmacy, unfortunately, if it's the ER or the hospital, you pull that list, you hand it to the provider, they know exactly what you're taking. Instead of looking at your chart and trying to figure out if anything has been stopped or changed, or trying to talk to you, that little pink pill, how many times are you taking it? If you have that list, you can give it to all of your providers. If you see somebody outside of Kaiser, if you're down in Florida and you go to the ER, if you maintain that little index card, all you have to do is hand it to them and they know exactly what you're on. And that is to help protect you. so that they're not going to give you a medication that interacts with something that you're on, or something that give you a second dose of something you already took this morning that could be too high of a dose then and be dangerous to you. So, you know, in this day and age, we have so many different systems and providers, and they don't communicate well. So you have to be your own advocate and, you know, kind of the manager and the director of your own health. And I can tell you, I've worked in a few different settings. I've worked in hospitals, I've worked for the VA, I've worked here, and the process runs so much smoother when the patient can just pull out that card and everyone knows what there is. There's fewer errors that happen.